And during this session, I'll interview 4 special guests differently involved in Cochrane rehabilitation. A little introduction. Welcome to Francesca Gimigliano, professor and chair of the residency program in physical rehabilitation medicine at the University of Campania, Luigi Vanvitelli, president-elect of the International Society of Physical Rehabilitation Medicine and chair of the communication working area of Cochrane Rehabilitation. Then we have Mauro Zampolini, physiatrist at the Department of Neurorehabilitation, Foligno Hospital in Perugia, Italy, president of the European Union of Medical Specialists in Physical Rehabilitation Medicine Board, a member of the advisory board of Cochrane Rehabilitation. Welcome to Professor Aydan Oral. That I don't see that. I think that she.
Thank you. I'm here.
Okay. Welcome, Professor Aydan Oral, in the Department of Physical Medicine and Rehabilitation at Istanbul Faculty of Medicine of Istanbul University. She's Turkish delegate for the European Union of Medical Specialists in Physical Rehabilitation Medicine Section and Board, and she also acts as Secretary General for the UEMS PRM Section and Board. And last but not least, Margarida Freitas, a resident physician in physical and rehabilitation medicine and Portuguese ambassador of the International Society of Physical and Rehabilitation Medicine World Youth Forum. Welcome to everybody. Let's start with Francesca Gimigliano. Francesca, will you briefly explain the mission of your working area?
Sorry, you have to activate the microphone. Thank you, Sara. I'm very happy to be here. I welcome all the participants. The communication is an important mission for Cochrane Rehabilitation because it's very important that we spread evidence as much as we produce them. And the working communication area is particularly important for the knowledge translation strategy because its main purpose is to assure that all evidence that are relevant for rehabilitation stakeholders are available for them in an easy and in an easy format to be then diffused to all the people that needs to put in practice the evidence. And the stakeholders that we recognize are not only clinicians and allied health professionals, but also students, patients and caregivers, and of course, rehabilitation administrators and all policy decision makers. To reach all stakeholders, we work on different channels, as you know, as the secretary of our communication working area, that are the website, the social media, the blog shots and blog, and the newsletter. Sara, you're muted.
Sorry. Thank you, Francesca. And how do you judge the objectives reached till now in these first 5 years?
I have to say that I'm quite satisfied of the work that we have done so far. Probably I'm not the right person to say it, but we have some measurable things such as how many social media followers we have, for example. But let's start for the website. If you follow the Cochrane Rehabilitation, you have to know that you can find almost all our information on the website. The website is rehabilitation.cochrane.org. I will put it in the chat for you, or if Chiara can do it. And it represents a repository of all news, evidence publications, and all the projects that Cochrane Rehabilitation is running, and all other a lot of other information coming from Cochrane or from the world of rehabilitation. The website is continuously updated from people from the headquarters, and has been recently modified to give more space to the special projects from Cochrane Rehabilitation, in particular, for example, the recovery action, to collect all the important evidence on the rehabilitation of COVID-19. We are also quite active, as you know, on social media, and actually our social media activities have improved a lot since both Sara Liguori and Luca Miranda, who is the Secretary of Cochrane Rehabilitation, has joined the headquarters, because now we have managed to have a monthly editorial plan, and this is very important to make sure that we deliver certain information in an organized way. So far, we have 2,645 followers on Twitter, almost 3,000 followers on Facebook, almost 2,500 followers on Instagram, and we are going to reach 1,000 followers on LinkedIn. I have to say that we had an issue with the former YouTube channel, so now we have a new YouTube channel that you can find if you write Cochrane Rehabilitation. An activity that we started almost since the beginning of Cochrane Rehabilitation is the production of blog shots. The blog shots have been created by Cochrane UK, invented by Cochrane UK. And thanks to Chiara, we have learned how to do them, and we have started producing them from our perspective, because the blog shot is a slide in which a very brief summary of the most important news that are inside the Cochrane Systematic Review can be found. And we have started to produce these summaries for all Cochrane systematic reviews that are relevant for us as rehabilitation stakeholders. Now the production of the blog shots is done by Sara, who is also responsible for their for putting them on Cochrane Rehabilitation website and spreading them on social media and in our newsletter. And then there is the role of Margarita, who is responsible for the translation, but I don't want to spoil because Margarita will speak about this later. Another very important activity is the newsletter. Each month, if you are registered, if you are subscribers of our newsletter, you receive our newsletter. It's generally sent out on the second or third week of the month. It depends on if we have something that we have to wait, to some important event that we have to wait for. We wait the third week of the month, otherwise we send it on the second week. And it's organized in 7 sections. So in the first section, you find the report on special events that involve Cochrane Rehabilitation. In the second, you find a summary of the newly published review, the Cochrane Systematic Review, that are important for rehabilitation stakeholders, with the blog shot and the blog that it's a sort of commentary of the Cochrane Systematic Review. And the third section is dedicated to our partnership. We have a very huge network, as Stefano presented in his introduction. And the fourth section contains the list of the latest publication by Cochrane Rehabilitation, the fifth section on the Cochrane Corners, and the sixth section reports on the news and events of the world of Cochrane or the world of rehabilitation in general, including scientific meetings. And in the last session, you can find ways to how to collaborate with Cochrane Rehabilitation And it's very important this because if you're interested to collaborate with us, there are all the opportunities written there. So far we have 1,400 subscribers, which is quite good, but we also actually send the newsletter to the organization with which we are in good standing, and so they send it to their members, so we know that actually the newsletter reaches much more people. And another important activity is the production of the book. The book is an important activity on knowledge translation because it translates, it summarizes the evidence of the Cochrane systematic reviews relevant to rehabilitation in 4 different languages that are the ones of the 4 audiences that we have identified.
Okay, thank you, Francesca, for giving us a broad overview of the communication working area activity. Just a last question. What do you expect from the next 5 years of Cochrane Rehabilitation?
I think that we should focus in the next 5 years to see how much an impact we can do in speed, fasten the process of knowledge translation. That is the gap that there is from evidence to putting the evidence into the real practice. And I think that we should try to work more with rehabilitation professionals worldwide to try to scale up rehabilitation in the different health systems and to implement the level of education and training worldwide, above all in those countries where rehabilitation is not so much developed, and we should take advantage of the moment because now there is also the call of Rehabilitation 2030, so there is quite an interest for rehabilitation from the different policy decision makers, so it's important that we act now.
Okay, thank you, Francesca, to share with us your next, hopefully, goals of communication working area. Now, a question for Dr. Mauro Zampolini. Hi. How do you imagine the future of knowledge translation in Cochrane Rehabilitation?
Yes, I think that the knowledge translation is a fundamental scientific paradigm, as underlined from Tracy Hall. I must say that the Cochrane Rehabilitation Organization done a lot of work in this perspective, and I will thank Francesca Gimigliano that also a few minutes ago described the huge amount of activities that is aimed to translate the evidence into the practice. Of course, we have work to do again in the future, but I must say that we are in good stand. One very good example, one of the many examples, is the Cochrane Rehabilitation Recover, that has been an example how to simplify the access to the evidence. But of course, it is very important in the future maintain the different level of information, the level of consumers with a specific level of language, stakeholders and professionals. And but the problem is not only to produce, but the very challenging is how to reach them and how to interest them. So we ought to make more and more effort on this perspective. So we must follow the new way of communication, of course, to the social network, Facebook, LinkedIn, but also Instagram, because in each type of social network, we have a specific group of person of age, and so we ought to to invest on that but of course we are doing a lot of activities on this perspective, but also the microblogging such as Twitter, that is very important, I think. And but one things that we can have as a perspective is to invest in the chat groups, because WhatsApp, of course, but especially Telegram now is more and more popular, a way to transfer information. And there are also the line of information that coming from the medical or health news. And so we should explore also this perspective. I think that also the video, production should be a very important perspective, and an emerging perspective is also from the podcasts. So in the future, we can imagine an increase of information in mobile system. So we ought to invest also in the perspective of the production of knowledge to this platform, because especially in the youngest, this is more and more popular way to communicate. And we ought to look at also the robust implementation on digital health systems. Of course, we hope that there will be a changing of paradigm on using the health records of the patient, and to have a new way to access to the information, health information. So in this, we ought to invest in the perspective of use the evidence for support the sharing decision with the patient, for example. And so this is something that we ought to think about. And also the web conference system. And now during the COVID, we understand that the conference system is a good way. It's not alternative to the Congress, but it's very good way to communicate in very quick way, and communicate and also try different form of communication. And of course, this is a very important perspective in the next few years, because if we think that how the virtual reality is improving in this area and the different areas, and you know, now there is a lot of debate about the metaverse, which is the implementation of virtual reality in the simulation of things. So also this perspective should be taken account, because should be a new way of communication. But a very important aspect is the interactive mechanisms of core knowledge dissemination that should be mediated from artificial intelligence. This is the artificial intelligence in the health system is here. And so we ought to take in account also this perspective.
Okay, thanks a lot to Dr. Mauro Zampolini. Just a last question for you. Which dissemination strategies to improve divulgation and rehabilitation do you propose?
So according with the things that we underlined before, we should adapt the divulgation system. So we ought to make more and more easy access to the evidence through mobile system in the simplest way. For example, we ought to create a very simple repository of the evidence that could be accessed in the easy way with the apps or simple other ways, the evidence that are there. And this is very important, because when you are in the clinics, sometimes it's important to access in a very easy way to the evidence. And also in this case, the artificial intelligence should be important, because now there are a lot of experimentation about how to artificial intelligence can help health decision, medical and not medical decisions, and how to support and how to access to the evidence in order to do that. So also in this perspective, we ought to rethink about the way of production, and so I think we are doing that, but we ought to improve the way to generate a flow of information starting from the new evidence and adapting in a semi-automatic way the level and the way to spread the specific information through the different platforms that we underlined before. And I think it's very important to invest also to the video communication with the short videos with the subtitle, and creating something like a living library where you can just access to short video about the comment of this specific evidence. This is a way of communication that the youngest know very well when they want to access to the information. In the future, this way, I think, is going to increase as the way to communication. And also the podcast is very important, because the podcast is a way to listen about something, in this case, the evidence. And so I think we should invest on that in the podcast production. That could be quite easy, because we can use the videos and at the same time produce the podcast. And of course, we use very well manner Facebook and Instagram, but we can also put in evidence the information using stories. That is the way to highlight the information of the days. So not each day, but each week we should create a story about specific evidence. And also the Telegram channel, as I commented before, could be a perspective that this is another way of communication, is a chatting way, and should be also interactive. And so this is should be a way to experimentate something of different. And of course, it's important to improve the sharing of knowledge through the scientific society network, because this should be a way to amplify the production of knowledge. Of course, we are working on this perspective, but we ought to do more. And of course, the comprehensive communication system need the hour of work and the funds to support it. But I, as a president of UEMS PRM section, and I think also the European organization, we can plan to continue to help the knowledge translation, also support the knowledge translation through the funds especially dedicated to that.
Okay, thanks to Mauro Zampolini for your role inside Cochrane Rehabilitation and your continuous support. Now it's just 2 questions for Professor Aydan. Welcome. As chair of a publication working area, would you briefly explain to the public what is a Cochrane Corner, Professor Ora?
Thank you for the question, and I would like to express that we are very proud that we are celebrating the 5th anniversary of Cochrane Rehabilitation. As the publication working area, we are publishing Cochrane Corners in journals. Cochrane Corners are actually systematic presentations of the contents of the Cochrane library, actually Cochrane systematic reviews. These short works can easily be accessed and understood. A Cochrane Corner is a vehicle for knowledge translation, which is broadly defined as the process of moving from knowledge that we learn through research to the application of such knowledge in clinical practice. In the knowledge translation action cycle, it serves to adapt and to facilitate the use of knowledge in the context of use. The format for the presentation of knowledge is intended to be simple easy to digest, and includes key results that can be readily applied in clinical practice, and consequently, it is intended to facilitate the uptake of evidence-based practices. Specifically, Cochrane Rehabilitation Cochrane Corners aim to inform rehabilitation professionals about rehabilitation relevant evidence produced by Cochrane, with comments from a rehabilitation perspective.
Okay, thank you. And what has been your effort to make the dissemination of Cochrane Corner possible?
Indeed, we are very happy that our Cochrane Corners are disseminated widely, with the potential to reach out to a wider audience of stakeholders. Currently, we are involved in the publication of Cochrane Corners in 11 journals. A total of 125 Cochrane Corners have published so far, with 52 publications in 2020 and 44 publications in 2021. The long way for Cochrane Rehabilitation Cochrane Corners to become widely dispersed required efforts based on a comprehensive and methodologically sound approach for initial planning and also for building for the future to ensure sustainability and the continuity of the initiative. The efforts started with the preparation of long lists of journals with a scientific interest in rehabilitation, and continued with contacting journal editors, signing publication agreements with the journals, along with the very important task of producing Cochrane Corners with good quality and with rehabilitation perspective inside them, which is the essence of our Cochrane Corners. And we are really very thankful to journals for supporting Cochrane Rehabilitation's mission to enhance knowledge translation, to all the Cochrane Corner authors, internal reviewers within Cochrane Rehabilitation or other experts, and external reviewers who are members of Cochrane review groups, without the contributions of whom this initiative could not have been accomplished. Many thanks again.
Okay. Thanks to Professor Ora. Just the last question. Which criteria have you chosen to select a specific Cochrane systematic review to be commented on?
Thank you again for this very important question. Firstly, reviews on rehabilitation interventions in the Cochrane Library, which are identified and tagged by the review working area of Cochrane Rehabilitation. They use a certain methodology for tagging those reviews. These are the natural sources of Cochrane reviews to be selected, to be summarized. The list is also available at our webpage and regularly updated. It is also noteworthy to say that in a study conducted by Cochrane Rehabilitation, it was found that 1 in every 11 Cochrane review was directly related to the practice of rehabilitation. Additionally, we consider Cochrane reviews with topics rehabilitation professionals need to know about, need to be aware of, or they may be interested in. Currently, we use criteria in a broad range for the selection of Cochrane systematic reviews to be summarized with comments. However, in the near future, our criteria for selecting a review as being rehabilitation related can alter, particularly after the completion of the rehabilitation definition for scientific purposes project. A clear operational definition of rehabilitation is expected to be helpful in the classification of Cochrane reviews as being related to rehabilitation or not. Thank you.
Thank you to Professor Ora for your clear replies. Now, just a few questions for Margarida Freitas. Hi, Margarida. As translation manager of Cochrane Rehabilitation, how do you consider your experience in translation activity of Blockshot?
Hello, everyone, and good morning, good afternoon, and good evening to everybody. And I just want to say that I'm very happy to be here celebrating Cochrane Rehabilitation's 5th anniversary. And now, Sara, replying to your question, the truth is that it has been a great pleasure for me to work as a translation manager in this team. This position allowed me to meet many influential people and renowned colleagues in the research field. And also it's really a very inspiring team to work with. And as a translation manager, it is my responsibility to inform the translation partners when new materials are ready to be translated, and I help them to stay updated. And next, I upload the translations in the Cochrane archives, and I also help with some strategies to disseminate the translations among the Cochrane community. And regarding the blockshots, as you know, they are a form of infographic, a single PowerPoint slide, saved and stored as an image, and they present key information from a single Cochrane review. And because they are so easy to share, even in social media, that's why we started by translating the blockshots. And because they are also an efficient means of disseminating the Cochrane evidence. And when you translate your materials, or in this case, when we translate Cochrane Rehabilitation's materials, we can reach a huge number of people interested in the rehabilitation information. And this evidence becomes accessible even in communities that are not familiar with the English language. And we don't want to reach only doctors. We want to reach physiotherapists, occupational therapists, nurses, speech therapists, students, researchers, even patients. Sometimes. So in conclusion, to answer your question, it has been an excellent experience to be a translation manager here.
Okay, Margarida, and what goals have been achieved with blockchain translation, also in terms of languages available?
Okay, so over the last year, we have managed to achieve some important goals. We increased the number of languages, and also we increased the number of translation partners. There are currently 8 languages that we translate some contents, which are Italian, Spanish, Croatian, German, Dutch, French, Hungarian, and Serbian. And we are just about to be able to increase at least with 2 more languages. We are about to start the Polish translations, and I believe that in the next year we can start with the Portuguese translations as well. So another major goal was to create partnerships with the Cochrane geographic groups, which we accomplished, and these Cochrane geographic groups are helping us to disseminate our translations in their local communities. And last but not least, we are in contact with national societies of physical and rehabilitation medicine, and we also collaborate with international associations that support the development of rehabilitation care worldwide.